Okay, good morning. Let's have a quick look into what's new in OCT. I have no financial interest in any of the products that I will be discussing now. So, for the past 2 decades, we have seen tremendous development in the field of post-segment imaging, especially OCT, which started with time domain, now spectral, then the swept source and the OCTA. So the OCTA, when it was first new to us, it came in the form of OptoView AngioView, which had a 3 into 3 mm slab and a 6 into 6 mm slab. But then came the wide field OCT or OCTA, which was able to cover 12 into 9 mm scan in the name of Avanti or Spectralis OCT Plus, which can cover up to 10 lakh data points at the rate of 70,000 A scan per second. But still, we need ultra wide field imaging because we know the standard ETDRS can cover only 30% of the total retina, and now we know most of the retinal lesions can be located outside the ETDRS field. And then came the need for ultra wide field OCT, which is now available, or the OCTA, which is now available with the Silverstone swept source or the Zeiss Plex Elite 9000 and the Mirante from Nidec, and they all have to have an extra lens to capture the ultra wide field imaging. So this ultra wide field imaging can actually give the entire 200 degree of the posterior segment, and also it can take up to 23 mm scan starting from the vitreous to the corneum in corticoscleral junction. And also we can navigate and take the OCT across any area of interest along the periphery. So now we can know about the peripheral pathologies also very well. The handheld OCT is actually not new to us, but anyway, it has been available with Leica Envisu. The handheld probe weighs only 1.5 kg. This is possible by using the micro electromechanical scanning mirror called the MEMS, and it has a 1.3 meter flexible cable. So this can be used in ICU or in a pediatric setup, and this gives an image that is in par with the conventional OCT. This is the macula scan and the ASOCT, and this is maybe it might be available in a year or so, which is supposed to be the tiniest OCT called the pencil OCT that is being developed by the Roweck Germany, still awaiting for approval. It has a scanning system and a docking system, and it's supposed to be in the form of a pocket carrying mission. And next is the home OCT. Because of the increasing demand for the macular, increasing macular pathologies and the need for constant monitoring, something called as the home OCT has been developed, in which the OCT can be given to the patient himself. They themselves can take the OCT with a short training, and these images in the self OCT, the images are actually exported to the ophthalmologist or the trained person who will analyze the image. And if you see in this row, this is the conventional OCT, and these are the OCT taken by the home OCT. And the Notal home OCT is already available in the market, and they say it is costing around $1,000. And this has a very short learning curve. The patient can take OCT by himself, and the results need not be interpreted by the ophthalmologist. They have a software called the NOVA, that is the Notal OCT analyzer, which can show the presence of intraocular or subretinal fluid, mainly used in the AMD patients. And because already intraoperative OCT has covered by Adit, I'll just skip this one. So there is something called the binocular OCT. This is still in prototype. It uses the swept source OCT by incorporating the VISL technology, that is the vertical cavity surface emitting laser. It can be used for binocular simultaneous testing. It is self-operated and also used for pupillary examination and strabismus. This is the binocular OCT. At the same time, the patient can be presented with various image sizes. So simultaneously, the visual acuity can also be tested, and it can the strabismus or the pupillary responses can also be measured in binocular OCT. Next is the VISTA, called the variable interscans time analysis. This is again a swept source OCT. That is a software algorithm. This is still not available in the market, but this is shown to show the blood flow in the post macula. So this, what it does is it takes repeated B scans at 1.5 and 3 milliseconds interval at each point, and with the difference in these flow, it can show the blood flow rate. The area with the red has a good blood flow, whereas this one has a slower blood flow. This is an area of geographic atrophy with the OCT NFAS image and the OCTA NFAS image. And if we see, this area of retinal blood flow is it is more decreased than what is seen clinically. So this patient can have a progressive atrophy in future. So this is how it is utilized. And the OCTA can also be incorporated along with the microperimeter. So this MP3 microperimeter software can be integrated with Mirante. And this is the microperimeter taking the central 8 degree microperimetry, and this is the OCTA image. So the one-on-one is getting imported, and the software used is the Nidex Navis X platform. So it shows the point-to-point structural as well as the functional overview of the macula. Something called as retromodal OCT, which is again not very new, but it uses the CSLO technology with infrared lasers. And what happens is that we know that this is the confocal, the reflected light is passed through the center. Indirect mode is something called the refracted light is passed through the paracentral one. In retro mode, what they use is the laterally deviated light. How it is useful in practice is that this retro mode can actually show us the lesion more clearly or in a more elevated forms. So this is the PCV lesion. If you see, this is the FFA one, and this is the ICG pictures. This is the retro mode image. This is the right lateral and this is the left lateral. So we can actually visualize the lesions even without the help of angiogram. So still it doesn't show whether it's active or not. It can be used only with conjunction with other imaging modalities. And this is again and ultra wide field imaging retro mode vision. These are the nothing but the soft drusens, and interestingly we can see that the lesions are also present in the periphery. And last one is the adaptive optics in OCT. Adaptive optics is nothing but using the wavefront sensor in the reflected light, and it is said to give more histological picture of the human retina, and especially used for the studying the cones. And this has been adapted in something called as the optoretinography, which is nothing but it shows the function of each and individual cones and rods wherever we wanted to take the image. And Altris AI algorithm, the AI algorithm is now also available with the OCT, which is again currently also in the market, and this has been integrated with the Hewitt's H OCT, but it's also these images, this software can be used for any of the OCTs, and this is said to be 91.3% accurate as well, and it can detect up to 30 retinal pathologies. Thank you.